Welcome to another episode of
Black
Money
Money Matters.
My name is Jameca Patrick.
I'm Karen Weaver, and we're your hosts for Black Money Matters.
Black Money Matters. So, Mayor,
Yes.
today we need to talk about something that is serious and it impacts our entire community. I know we talk about Black money because we want to build wealth within the Black community and amongst Black families. But there is something else that we should talk about.
Well, and this is near and dear to our hearts,
Absolutely.
Jameca. Come on.
Absolutely.
You know, we're both mental health professionals.
That's right.
And so we always take opportunities to talk about mental health.
Every chance we get.
And you're a social worker, I'm a
Mhm.
psychologist. And so mental health is important.
Mental health.
And I think it's important too because we always talked about when we were talking about Black Money Matters,
Mhm.
how access to health care is
Mhm.
tied to socioeconomic status
Yeah.
so many times, and the quality of insurance and the quality of health care
Yeah,
that you get. And that's why zip codes matter,
that's why zip codes matter.
you know?
And that's why accessibility matters. That's why understanding matters. There's so many times when we talk about mental health in our community that we don't talk about it with the understanding that mental health difficulties, mental health problems are the same as physical.
I was going to say
problems.
mental health is physical health.
Yeah.
Physical. I mean, because they're
They're
all
tied
But you know
together.
what? We didn't say.
We-
This
what-
is National
Minority Mental Health Awareness Month.
Right. July is National Minority Mental Health Awareness Month.
So if you've been looking for a sign to talk about mental health, to get treatment, to get, therapy, to address your or your loved ones' struggles with mental health, this is your sign. Do it. Please do it.
Because one of the things we know is our community, the Black community especially, we don't have access to mental health
We don't have
like we should. And there are a lot of reasons for that. Some of them we do because of the stigma, so
Right.
we don't want to go for mental health services. But sometimes you're looking for a mental health provider that you think is going to understand you,
right.
From your own race.
I remember having a conversation with you once, and we were talking about therapists
Yes.
and therapy, and I was saying for me, it's important that if I'm going to be in therapy, I need to be in therapy with somebody Black.
And being in therapy is difficult enough.
Mhm.
You know, it's hard enough.
Mm-hmm.
And so you want someone that's going to understand you,
Mm-hmm.
what you're going through, your struggles, understand your social support
Mhm.
systems, and all of those kinds of things in our culture.
Yeah, and one of the reasons for me is because if I walk into my therapist's office and I say, I was stressed out last night because my son called me. He was pulled over by the police. I need somebody who is going to innately understand that that's a stress. It's
Right.
a stressor
Exactly.
for a Black mom. It's a
Exactly.
stressor. And I don't need to explain that, yes, he has driver's license. Yes, he follows the law. No, he doesn't get in trouble. No, a routine traffic stop isn't a routine traffic stop for Black men.
Right.
And so it's stressful for Black moms. And so things like that matter.
Right.
They matter. And so that's why representation matters. That's why we need to be sitting in offices with people who understand what we're going through. And like you said, understand our culture and things like that. But we also need to have families that understand that when we need help, we need help. So many times, and I'm a Christian. I am a Christian, and I believe in prayer.
Mhm.
Prayer, praise, that's what I do. I'm a pray through every situation. But I also believe that if you tell me that you've had a headache for a week, I'm gonna pray for you. but I'm gonna send you to tell you go talk to your doctor.
Exactly. But here's what gets me is because I believe the same as you.
Mhm.
Yes, I'm Christian. Yes, I pray. I said, but if we say I'm having trouble with my diabetes,
Mhm.
if I have cancer, if I've had a stroke,
We
no
pray
one
for
says,
you.
but they don't. But they say you better go to the
You better
doctor.
go to the doctor.
And so we need to get into the same mindset for mental health
Mhm.
issues, and you go to that provider
Yeah.
that can help you with what is going on.
I'm gonna pray for
And
you.
so,
But you
right, but you need to do both. And I
see your
believe
mental
that
health
God put
specialist.
people there to help you because He says you're supposed to, help yourself as
Mhm.
well. And I've given you these tools and I've put these
Mhm.
professionals in place. And it's for your mental health as well because mental health is physical health, and we need to stop separating them out.
Stop separating them out. So in every community, there's a community mental health.
Yes.
In Flint and Genesee County, it's called Genesee Health Systems. In other places, it may be called other things, but there's always a community mental health that you can go to. You should be able to access services through either your insurance provider or your local community health, community mental health if you don't have an insurance provider. And again, in Flint and Genesee County, it's called Genesee Health Systems.
Mhm.
So we want to make sure people know that there's help available, whether you're insured or not.
And there's other places as well. I mean, you can go to Hamilton.
You can
You
go
can
to
go to Mount
Hamilton.
Children's Health
Yeah.
Center. You can go to, where did you say, Genesee Health Systems? There are, services are available. And that's what we want people to know.
Yeah.
And don't be ashamed.
Don't be
to go.
ashamed.
I mean, really, you should say, I did this. And we
It,
need to normalize.
it's part of, like you say, it's part of physical health.
Right.
Because I was telling somebody the other day, if I stub my toe, I'm calling my doctor. And so if you're having any sign, you just don't feel right. You don't enjoy doing the things that you used to do. You're not doing the things that not just not enjoy. If you don't enjoy doing things you used to enjoy, or if you're not doing things that you commonly do, like take showers, socialize with people,
Right.
eat, those types of things, you need to go talk to somebody.
Having difficulty sleeping or sleeping too much.
Yeah.
Or there's the other extreme. You may be so hyper, you're doing all kinds of things.
Mm-hmm.
But whatever the issue is, there's help available.
Mm-hmm.
I also think we should let people know about there's a suicide hotline.
Absolutely.
If you're ever feeling like you're hurting yourself
Mm-hmm.
and you need somebody to talk to, there's a number, you can call
Mm-hmm.
and help is available.
I want to talk for a minute. There's a lot of trauma in our city.
Yes.
There's a lot of trauma. We've experienced a lot. So, we've experienced a water crisis.
Mm-hmm.
We've experienced the pandemic along with the rest of the world. So we experienced a water crisis that was unique to us.
But there's been a lot of crime. We've lost a lot.
That's what I was going.
This community is hurting
right now. It seems like it ebbs and flows, and ebb more than flow.
But this past week has been terrible.
Yes,
the loss,
and
that triggers others' losses.
Mm-hmm. And so grief and grieving and being stuck in grief. If you need to talk to somebody, reach out to somebody. There are private therapists, and again, there are those public places like My Children's Health Center, like Genesee Health Systems, like Hamilton Community Health Center.
There are groups that people can go to.
Support groups
that you can go to, and then people need to understand grief isn't something. In 6 months you're going to be through this. That's something that you get to deal with, so you can continue on. But it comes and goes, and you never know what is going to trigger your grief.
A smell. I was in the store once, and I saw a sweet potato, and it triggered a memory that just sent me on a tailspin in the store. So you never know. Right. You never know. So,
and I think we should be talking about this. I'm glad we're talking about it, and I have noticed that you hear people. You hear them in the churches talking more about mental health, and that's a good thing, and starting to normalize this because that's what it should be. That's what it should be. Yeah. And so we just want to give people a reminder that mental health is physical health. Don't deny yourself services. If you find that like you said, you're in trouble. You're not feeling right.
Not feeling right.
You notice somebody else, because one of the things we always talk about, I'm gonna talk about depression for a minute and go back to suicide. Usually they've shared those feelings with somebody.
Or you notice them. You notice
Right.
when that person
And they
is
keep it a
sleeping all
secret.
the time.
They keep it a secret, and that's why I say secrets can be deadly. If someone talks to you about that, you need to inform somebody. Let them know that help is available.
Pay attention to your loved ones. Did your favorite aunt just all of a sudden stop coming to the gatherings? You can't get a hold of her or your uncle or cousin or whatever. Pay attention to your loved ones. When people aren't doing the things the same way as they used to, have those conversations and offer support. Hey, do you want me to drive you to the therapy appointment? You want me to call somebody? What do we need to? Let me find you some resources. Because like you said, this is life or death. And oftentimes, like you say, people start feeling those suicidal thoughts. And then when we don't share or we don't reach out, things happen.
And pay attention to your seniors, because so many seniors feel isolated. Because a lot of their friends have gone on, and they're, I'm alone and I'm losing my friends, and who do I talk to? Where can I turn? And having difficulty just getting out to do certain things. So check on people, because it could make the difference, like you said, between life and death.
Absolutely.
Between life and death. And sometimes the issues aren't as bad as we think they are. And you can get that help, and you're like, man, I wish I had done this sooner. I wish I had told somebody sooner. I wish I had talked to somebody sooner. I wish I had gone to this therapist. I had participated in this group. But I think we should talk about some other things, some non-traditional kinds of things that help with mental health issues, like yoga.
Oh my goodness.
Yoga is something.
Yoga helps with anxiety, with depression,
ADHD.
Yes.
There are a lot of kids with autism that yoga is good for. So that's when we talked about mindfulness. I mean, taking an art class. I mean, these are things that help, with your mental health. And so, we need to get involved in those kinds of things as well, because they're very, very important. Music. So there are a lot of other things that, sometimes I'm having a bad day and I just need to turn up some music, and I play the kind of music that gives me those good feelings. I was doing that last night. I did.
So what are some barriers to care?
What are barriers? Sometimes it's transportation. I mean, I know when I was at that was one of the big issues. It was hard if you don't have a car and you've got kids, and you're trying to you got to take your kids with you. So transportation can be a barrier. We talked about the stigma. I don't want anybody to know. People are going to talk about me. They're going to say I'm crazy. They're going to look at me funny. The insurance. I don't have the money. That's a barrier. I'm trying. We need Black providers. Let's just say that we need Black providers. Sometimes you're sitting in class, you might think it's a lot of us, but it's not. When you all go your different ways, there are very many Black providers. And that's sad that there are not. I know Landon talked about a Black-owned mental health facility, but it was south. It was a Detroit suburb, I believe.
So for our Detroit folks, find them.
Right. But it would be nice if I wonder if we could get a list of who the Black providers are in our community.
I do want to point out that GHS has moved locations.
Okay, where are they?
They're at the Bristol Road and the old Baker campus.
Oh wow. Okay, I didn't know that.
Yeah, so more a bigger location. Right there.
And there's the bus line is right
there, literally, right in front of the building. And so, helping to make services more accessible.
Exactly. So it's not Minority Mental Health Awareness Month.
Pay attention.
Right.
Let's be intentional about destigmatizing mental health in our community. Let's stop telling people that they're crazy when they need help. Let's offer people support. Let's help people access resources. Let's treat uh, mental health, disorders, bipolar, schizophrenia, the same way we treat heart conditions and diabetes and high blood pressure, encouraging people to stay on their regimen,
Right.
encouraging people to seek providers, helping people to access resources, those rise to wellness and such.
Right.
Let's help people. Let's remember that healthy families are strong families. Let's do that. Let's normalize getting treatment. Let's be intentional about that. This month and beyond. Let's start this month, but let's do it this month and beyond.
And pay attention to yourself. Pay attention to yourself and how you're feeling, and pay attention to those things, those triggers that do make you feel a certain way. So if you're feeling bad, you say, I'm gonna go do this. But pay attention to yourself and pay attention to others around you.
Absolutely.
And help us all get the help that we need. So we're going to be talking about this again, National Minority Mental Health Awareness Month.
Yes, we will.
I think we should.
You all tune in. Thank you for joining us for this episode of
Black
Money Matters.